As a public health expert, when you look at the numbers in terms of hospitalizations and the people who are getting infected, and when you look at how the third dose is going, which is not very well, how nervous are you about this sixth wave?
You're right that the third dose has not been taken by everyone, and there was a complexity in relation with that because the infection of Omicron that touched so many people retarded them to benefit from the third dose, of course. But what we see is that the third dose has been really taken by most of the people that are at risk, so namely the people older than 60 or other persons that were really at risk. And those figures are very important for us. We opened for the fourth dose because of the length of time between the third and the fourth. That has been explained by my colleague, Dr. Lontin, that could diminish the efficacy of the vaccination. But essentially, we're very happy with the numbers that we have right now. Unfortunately, the vaccine is not perfectly, it's not the efficacy of the vaccine to prevent hospitalization is not 100%. It's more than with 3 doses, you're more than 90% compared to a person that would not have benefited from the vaccine, which is great. And but unfortunately, we have some cases, and this is why we have to be really, really prudent and having the lowest profile of contamination possible, not to exceed our medical capacities in hospitals.
So just to round it up, when you see those numbers, when you see that essentially your only line of defense right now is the mask,
yep,
and some vaccination, some third dose, how do you feel as a public health expert?
We're not worried, and in the point that we're saying we're going to be confronted to something that will not be controllable. Okay. I think if the vaccines were not there, it will be a catastrophic situation, a catastrophic one. The fact that most of the people have benefited from 2 doses, and a lot of them are 3 doses, and namely the persons that are at risk, it's something that is a game changer for us. So it will be impossible to discuss the same way if there was no vaccine or the population were not vaccinated. So it's great for that. But still, we're worrying about the number of cases that are going up. The hospitalizations are too. It has been very difficult in the last few days in some regions because of the health capacity of delivering the services at the hospital level, or for the rest of the health and social services care. And this is something that is in relation with this contagiosity that is very high. So this is why I think that it's fair for everyone to get concerned and being sure that when they are infected, they can think that they will be contagious for a length of 10 days and act with that in mind. And the other thing is to continue to wear the mask. With those 2 measures, I think we can hope that this wave will turn and we will get a nice spring and summertime.